So how are we doing that? What are we doing? Where are we targeting our efforts to address the Millennium Development Goals and to prevent those 1.8 million deaths every year? Well, we have 5 main target areas. The first one is, again, the cornerstone, which we can call health-based targets, or those guidance documents. And so we're currently working on the 4th edition of the Guidelines to Drinking Water Quality. In terms of the link with plumbing, well, we're also developing guidance for regulators. And part of this, with the World Plumbing Council, is an issue paper on plumbing regulations. And we're also working with the World Plumbing Council on this particular one to standardize, to harmonize internationally definitions and terms in the plumbing industry. In terms of utilities, so these are the larger water utilities, we're working on, with the World Plumbing Council, building plumbing-related capacity. And we're also working on, as an example, a publication. We just released it in Lisbon this past spring, showing water utilities with a how-to manual on how to input and use water safety plans to better protect their consumers from potential waterborne illness outbreaks. In terms of small water supplies, this is one of my babies, is we are building the evidence base. It's an important issue, but very little is known about it globally. And so we're first building the evidence base and developing guidance documents and tools for use by our member states, for use by countries around the world. In terms of treating water at home, well, we're doing the same sort of thing, building the evidence base and advocating for families to begin to treat water at home with simple, cost-effective technologies. It doesn't always make sense if you've got all these farming communities spread out to put in piped water supply. Sometimes it makes more sense to empower families to treat water at home. In terms of the priority settings, one example of work that we're doing is we are currently finalizing guidance on sanitation and hygiene within aviation and the ship industry. And with the World Plumbing Council, we're developing guidance on high-risk buildings, so schools and hospitals. So I'll give you some history about the World Plumbing Council and the WHO relationship. But first, I want to briefly mention some of the World Plumbing Council's objectives. And as I mention them, you'll see how closely our objectives, WHO's and the World Plumbing Council, overlap. So some of their objectives are to develop and promote the image and standards of the plumbing industry worldwide, to encourage and facilitate the exchange of information, ideas, and technology between plumbing industry organizations and individuals worldwide, to promote and assist in plumbing industry education and training, recognizing the need for appropriate standards and their international recognition. Now, as you know, both the World Plumbing Council and IAPMO are co-conveners at this symposium. The IAPMO group is a full member organization of the World Plumbing Council, and they are actively supportive of the WHO-WPC relationship. I also understand, having heard this morning, there's a number of other members of the World Plumbing Council in the room today, such as the Institute of Plumbing Australia, and of course, I've met the Indian Plumbing Association again this morning. Nice to meet you again. I understand they're also supportive of the World Plumbing Council WHO relationship. Now, in terms of our work, well, we had a major flagship publication released in Beijing in 2006. And that's this document, Health Aspects of Plumbing. Essentially what it does, it emphasizes the importance of plumbing from a public health perspective. And it also speaks to and describes the design of installation and maintenance of effective plumbing systems. Now, normally we sell these for, at cost for publishing it and printing it, but I have a few copies at the back, so feel free to help yourself and grab a copy of this before you leave. In 2007, 2008, we began to intensify our relationship, and John McBride has begun to work very directly with the World Plumbing Council and WHO, specifically on our shared areas of mutual interest. So in terms of the objectives of this intensified cooperative relationship, well, we want to emphasize that plumbers are frontline workers in public health protection. They're where the rubber hits the road in many respects. And we want plumbers to understand the importance of their role in preventing waterborne disease. And we want to have those who engage plumbing services to understand that plumbers are more than someone that you just call when, oh, my toilet's backed up, can you fix it? And they're more than just someone that can move water from A to B. Plumbers can actually prevent waterborne disease outbreaks, and they can improve public health. And we also want regulators to understand this as well, so they can better design plumbing regulations, so that we can, for example, have regulations that support and encourage training and education to an appropriate level for plumbers. So in terms of these 4 items that we're specifically working on, I'll speak to the first 2 later on in my presentation. They're the ones I am certainly most familiar with. But with respect to the last 2, in terms of addressing the global training shortfall, we've just finished I understand we're finishing a training program trial in Australia in terms of capacity building. And I understand arrangements are put in place to begin training in India and on the Solomon Islands. With respect to leading the development of appropriate standards for high-risk buildings, as I mentioned, we're looking at developing guidance to complement health aspects of plumbing, but focusing on the high-risk sites like hospitals and schools. So in terms of the first one, which is accelerating effective and appropriate regulation, regulations are an incredibly powerful tool for protecting drinking water. In the absence of regulations, we see elements and accountability and liability being compromised, leading to potentially outbreaks of waterborne disease, and certainly higher risk to the consumers, to our communities. Even where present, we know that regulations are not always used to their best advantage. What we've been hearing from regulators and senior government decision makers is they're saying, okay, well, you develop these guidance documents, the guidelines for drinking water quality. It sets out numerical values and it sets out management approaches, but what can you give me as a regulator in terms of guidance? Can you design guidance that's specifically designed to my focus area, my area of interest? Now, the good news is that we have a group of expert regulators from around the world, and they sat down and they worked together with us to identify 19 core elements for protecting public health as it relates to drinking water, and they identified plumbing as being a key element. So this is an excellent opportunity for us as WHO and the plumbing industry to emphasize the importance of plumbing and to get it appropriately reflected within regulation. And so the World Plumbing Council has developed a draft issue paper. And again, this is draft. It has to be still reviewed by our network of expert regulators. And essentially what it says is it establishes in language that regulators can understand the importance of plumbing from a public health perspective, again, our message over again, and establishes that plumbing regulations can protect public health. And then it illustrates how this can be done, and it even recommends key components for regulation. So I'll list those 4 key components, keeping in mind the document is still draft and needs to be reviewed. But the 4 key components is that regulation should be designed to protect public health. First one, it should have minimum standards for materials and for installation. It should have minimum standards for training and education. And fourthly, needs to be oversight, needs to be enforcement. So needs to have mechanisms to make sure it's being followed.